Yes, it's Monday, the 1st of September, and your health segment this morning we're focusing on child mortality. Maternal mortality is one of the subjects we've talked about quite a bit, but today we focus on the children, and joining me in studio is Dr. John Wachira, who's Executive Board Member, Kenya Pediatric Association, and also Hassan Aimoy, Public Health Executive, Mandera County Government. Good morning, and thank you both for joining us. When we're talking about child mortality, John, Dr. Wachira, talk to us about that, what it means, what it covers.
Okay, when we talk about child mortalities, we are looking at how many children are dying in the country. We are looking at it in terms of maybe a national average and also looking at local region. If you look at Kenya today, we are talking about, okay, we pride ourselves in having gone down to 74 deaths per 1,000 life births per year. But if you try to break down that, it comes to about 300 children dying every day. We are talking about by the time we are through with this show, every 4 minutes a child is dying somewhere in Kenya of preventable things, and children should not be dying. Again, we talk about newborns, about 33 in 1,000 dying per year, by every life birth in Kenya. And yeah, so that's where we are in terms of child mortalities.
So at birth you're seeing still very high numbers?
I mean, we have not
still births.
We have not made any progress. I mean, we have made minimal progress if you just take 20 years ago. You know, if you take the Kenya Demographic Health Survey of 2003, the newborn deaths were about like 33 per 1,000 life births. If you look at where we are now, we have just made a small progress to about 27 deaths per 1,000 life births.
Okay.
Yeah.
And maybe you can help us understand and put that into perspective for us in as far as Mandera County is concerned and what the situation is there.
Thank you very much. And if we look at maternal mortality, the child has highest risk of dying in the first 28 days of delivery, and this ties very much close to with the maternal health. Did this child receive safe delivery? Was this child delivered in a health facility? What was the health of the mother before the child was born? And during pregnancy, and all this ties up very well. But if we look at in terms of the country, and I think Dr. Wachira said, although we have made a modest gain of up to 74 deaths per 100,000 life birth, this differs very much across the country. If you take, for instance, Mandera County has the highest maternal mortality in the country. I think we captured a part of this last week. 37,000 women are dying out of every, 3,700 women are dying out of every 100,000 life birth, which is the highest in the world ever recorded. And this also ties very much close to the child health. How many children are dying then? Is it only the mothers who are dying, or also the child, the children are also dying? How many of these children are living beyond the 28 days, the first 28 days days of their life? How many are reaching their fifth birthday? In putting it in perspective, in Mandera County, a child born in Mandera County has a 53% chance of reaching the fifth year of birth. This is quite low if you compare to the country average. If you look at the chance of completing immunization, child born in Mandera is 60% less, has 60% less chance of finishing complete immunization compared to a child born in Kirinyaga County. This is the disparities that need to be clearly articulated for us to have to make a considerable gain across the country.
So what are the contributing factors? What is getting Mandera in that situation and other parts of the country? Why is it we're seeing this many deaths, especially for children?
Okay, yeah, and the disparity in mortality is huge in this country. And I mean, if you look at northwestern and northeastern Kenya, that's why you have the worst deaths in the country. And you know, if you just look at them generally, you can see climatic things, you know, semi-arid, no food, high levels of poverty, high levels of illiteracy, high levels of I would say the women and the mothers are not empowered. If you look at it's a whole complex problem.
It's a spectrum of issues.
It's a spectrum of issues. Yeah, even roads. You know, if a mother is in labor,
how to rush them to hospital.
There are no roads in some of those places. Again, access to health facilities. There is no. People have no access in terms of even the road network. Come down to the availability of resources, allocation of resources. You got people have got so many other priorities that they are grappling with, that health is the last thing that they're going to allocate any money to. Yeah, so it's a complex problem. But top on it is that you have got disorganized allocation of resources, and two, you have got failure to involve communities in tackling the health issues, and then sort of poor engagement of the many players, the many stakeholders who are in the various regions in this country.
Okay, and where do you see the situation changing now that you have healthcare devolved? So you have the money going down to the grassroots level where there's an understanding of the issues being faced. Do you see that changing with the devolution? For
sure, yes. And I think many people might have said this before, but I'll repeat this statement, that devolution is one of the best things that happened to the health sector in Kenya. Despite the initial teething issues that we are facing, but devolution is the best thing that ever happened to health sector in Kenya. Look at, for instance, our country was quite a large country. Kenya is quite a large country. And having it managed from a central perspective, especially in a sector like health, which is highly decentralized, has really proved difficult in the past. To put this in clear picture for you, you look at Mandera County, for instance. When we took over in March last year, out of the 52 health facilities, which was quite tremendous because that was a significant investment, but only 10 were functional.
Wow.
The entire county had 154 health workers. The entire county, 154 health workers. Put that in comparison with maybe Thika Level 5 Hospital, which has 464 staff at that particular time. Now, in the county's context now, the counties are able to clearly focus on their specific challenges and put their health need in their context. The nomadic lifestyle in Mandera County differs, for instance, in a county where Dr. maybe Washira comes from, which is quite maybe settled type of lifestyle. And therefore, counties are able to focus on it. And if we look at this focus clearly, counties which are the lowest number of health facilities are started investing in putting up more infrastructure to increase access, to put in more staff where there were no staff. For instance, in Mandera County, our number now stands at 500 staff, meaning we have made significant progress.
From 150?
From 150 last year to 500 now. And all the 52 facilities are open, and we even opened extra 4 facilities. Now we stand at 56 health facilities which are open, and our functional, our definition as functionality is at least availability of drugs and availability of maybe one skilled health worker on the ground.
Okay.
And this is what devolution is doing, and with this, then our children will be able to access immunization. Our mothers will be able to access antenatal care before birth, and have celebrate their childbirth in a more secure setup.
Yeah, Dr. Ashira talked about some of those factors that are contributing to these deaths. You mentioned that a huge number of children, especially in your county, are not going past the age of 5. They're dying before that. Are they the same factors that apply for Mandera?
Some of them are the same factors. Quality of service is cross-cutting. Availability of health workers and then the necessary emergency response is cross-cutting. If you look at issues of road, which in the previous interview it was quite discussed, road is such a critical support sector to the health sector. With no, maybe passable, let me use the word passable, because in our area we are just, we just launched our tarmac the other day. Without a passable road network, then even investment in ambulance becomes a very expensive undertaking. Moving a child or a mother from point A to point B is quite a difficult undertaking. But on the other side, issues of nutrition is quite critical. If you look at the number of children who are malnourished in Mandera County compared to other counties, is quite different. But what is the underlying factor is, what was the health of the mother before the child was born? How well are the children spaced in that family? How many children are this particular household taking care of at that particular moment? The last DHS shows we have one of the highest fertility rate in the country, and our average family size has been put about 6 children per family. compared to the other part of the country where it is different. Our uptake of contraceptive is very low, 4% compared to the country's average, or even maybe central province, the former central province average of 60%.
Right.
And the country's average of nearly over 40, I think, by now, if not approaching 60.
Right. Doctor, in as far as the preventable diseases that are affecting the children, talk to us about the most common that we are seeing.
Okay. Last year, Kenya lost 100,000 children under the age of 5 years. About 30,000 died from diarrhea. About another 30,000 or 20,000 died from pneumonia. Another 30,000 died from fever that was maybe called malaria, that had other things like bacterial infections. A small number from HIV, TB, and such other conditions. So really our top killers are pneumonia, diarrhea, a bit of malaria, and a bit of other fever-related conditions. And that is across the whole country. And these deaths are purely preventable. There is vaccines for it. We have the pneumonia vaccine that was launched by the previous government. We have the rotavirus vaccine that has been launched last month by the current government. Those vaccines have got they can actually reduce those deaths by about half if they're properly used. You have got other interventions that are available that are low cost but high impact, that are available countrywide for these problems. Okay. So the problems that are killing our children are few, and there is solution to it. But back to the issue of devolution. If you look at I talked about disorganized allocation of resources.
Right.
Counties are receiving funds, but if you look at it technically, how much funds are they allocating to health? The Abuja Declaration, which put a figure of 15%, which is a very low figure. If you look at what health has not been achieved by any county in this country, has not been achieved by any government so far from 1963 up to now. And so we have got low allocation of resources. And even when it gets to the counties, I mean, you get a bit uncomfortable when you see counties prioritizing things like CT scans and machines that will cost billions of shillings or millions of shillings, when they are low-cost interventions that could actually reduce the mortalities. Yeah, those high technology is good. And the ambulances that are being bought by counties, they are good, but they're not a priority.
Yeah.
The problem, people need to look at what is killing our children, what is killing the mothers, what can be done. Simple things like breastfeeding. How do we overcome the social barriers? Simple things like the vaccinations. How do we overcome the financial barriers, the social barriers, the infrastructural barriers? How do we overcome the deterrents of health in the health centers? So there are big problems that have not been addressed, and will not be addressed by just a figure in terms of money. It needs careful thinking through the process of not only allocating the funds, but utilization of the funds, and even how people allocate these funds in the various corners of their county.
So he's highlighted some of those diseases that are preventable by killing many of our children. Is it an issue of illiteracy that these mothers do not know that they should take their children for immunization, that there's immunization available? Is it funds? They don't have the money to do it? What is it?
In the past, it has been issue access.
Okay.
How many of the health facilities have functional refrigeration services for immunization? And how many are getting their vaccines on time? What is the stock out level maybe between the deliveries? In the rural areas, this is quite an issue. The other aspect is ignorance, definitely. What is the level of investment in public awareness? We have gradually reduced our investment in preventive health and focus more on clinical. Clinical is taking the huge chunk of our money. It is sort of assumed that Kenyans have over time got used to immunization, and every child born in a health facility is supposed to get a vaccine, or even the one born at home will at least be brought for the first BCG vaccine within the time limit, but this is not happening. If you look at resource allocation in the county setup, Dr. Wachira mentioned, we need to put this in county specific. The amount of maybe resource allocated to county A vis-a-vis the human resource that they need to take care of is different. While Mandera might be having opportunity to hire more, others are really struggling with the bulk of their money going into recurrent expenditure in terms of payment of salaries, which is okay, because human resources is a critical component in the health sector. But overall, most of the counties have invested over 15% of their budget in health sector. There are some counties which have invested up to 60%. I mean, up to 30%. For Mandera County, it has been gradual. Last year, we had 9% investment in health sector. This year, we have 12% investment in the health sector. And this is clearly staged. And and in the first year, it was low, because we have to understand our context. What are we dealing with first? What are our main problems? And then gradually start investing, addressing that.
Yeah, and the indication I get, Dr. Ashira, is that this is a multi-sectoral approach that will be needed in as far as reducing those numbers on child mortality, because we're talking about malnutrition on one hand, there's the vaccination or immunization, if you like. So the different issues, it's not all on health questions, but there are other issues even as far as the county governments and even national government coming together. Wouldn't you say that needs to happen to ensure that these numbers do not continue to rise and in fact come down?
Yes, I totally agree with you. One of the illusions of this nation is that people think health is doctors and nurses and big hospitals. When people talk about allocation of resources to health, they're looking at buildings, the health centers, the dispensaries, the health facilities. It's worth thinking about where are the deaths occurring.
Yes.
Most deaths actually occur in the community. And even if they don't occur in the community, the child will be very sick in the community and either die on the way to the hospital or die on arrival at the hospital. If you go to Kenyatta or any of the referral hospitals or even the small health facilities, the children will die in the first 24, 48 hours of arrival. Those deaths actually did occur in the community. How much are we putting in the community? Look at our wage bill. 80% of the wage bill in health is to the health facilities. You're talking about paying doctors, nurses, and the other cadre of workers in the dispensaries all the way to the referral hospitals. What's happening in the community? We actually work with the volunteers in the communities. We have very few, I'm not aware about paid health workers in the community. You know, people who should be doing interventions in the community. If you look at interventions, again, they need to be multi-sectored. We need everyone to play their role. We need the public sector, we need the private sector, we need the civil society. We need all of them to engage with the communities.
Yeah.
You know, it's very hard to overcome socio-cultural barriers in the hospitals. Those can only be overcome in the community. It's people in the community who know why the children are not being taken for vaccination. It is them who know why the mothers are not breastfeeding. It is them who know why they don't diagnose diarrhea and pneumonia in the community. You know, studies done in this country show that people in the community, they don't perceive diarrhea as an illness. Some of them think it's teething. It's killing about 30,000 every year.
Yes. People
don't know how to grade the severity of pneumonia in the community. So we can't, if we continue doing the things that we are doing, allocating resources in the hospital, then the deaths will continue. So we need more players and working out more in the community now, and still good investment in the hospitals with more engagement within the community.
Yeah, a fundamental change, mindset as well in how issues are being approached. As we bring this to a close, Amoy, in terms of priorities for the county governments, for all stakeholders involved, what is priority now to deal with this child mortality? What should be at the top of the list?
To borrow from ancient Greece.
Yes.
In the ancient Greece, doctors are paid so long as their patients remain alive.
Okay.
And that means serious investment in public health. If your patient are not falling sick, then you get paid. If their patient falls sick, then they make follow-ups and ask the doctor why your patient is falling sick, and therefore maybe the doctor has not done much in terms of investment in preventive health. So number one is preventive health. That is top in our mind. And preventive health is specifically investment in community strategy. Our country has done a wonderful write-up in form of developing the community strategy. This community strategy advocates for establishment of community units within the communities with trained community health workers to link the population to the nearby health facility, and also address many of the preventive messages, pass on many of the preventive messages that need to be passed on. So top on the list is prevention. Number two is our concerted effort in addressing overall what is killing our children. the leaders across the county and the country should stand up for our children and say, why do we have our children dying in the 21st century, which are nearly approaching another century? Yeah. Why are our children still dying from preventable illnesses? How can we address these preventable illnesses in terms of proper allocation of budget to right places where they should be allocated? Okay. Not just blanket allocation.
Not blanket allocation. Finally, yes. Doctor, on your part, last week there was a conference held that was opened by the First Lady. What are the issues that were discussed? What is the focus in as far as, because this is pediatrics from all around the world coming together, what are the issues that you were discussing at the conference?
So last week, Kenya Pediatric Association hosted more than 30 nations in this country, in the people coming from the low-income countries, to discuss, to check where we are in terms of Millennium MDG 4 and 5 and 6 achievement. And we were sharing experiences and seeing why is Tanzania doing better than Kenya with the mortality, other 5 mortalities of 54. Why is Rwanda doing better with figures of 55 when we are at 74? So the issues that we discussed was how to reduce these deaths. And what came up was, one, there has to be the focus on newborn health. You know, the people who are dying, the highest group of people who are dying in this country are the newborns. They are unrecognized, they are unregistered, they are unattended, and nobody pays attention to them. They actually die and they are marked in unmarked. They are buried in unmarked grave. You know, they are still not attempting to live. So there has to be a focus on newborn health, and this has to involve the communities. We have to go back to the community and find out what happens in the pregnancy, what are the barriers to seeking care, what is preventing mothers from giving birth in the health facilities. So there has to be a focus on newborn health. Okay. The second thing that came up on was community engagement. You know, as Amoy has said, we have focused more in the health facilities, and now we need to refocus now in the community. Yes. Kenya has brilliant policies. Kenya has some of the best policies in the world on health strategies, and we could just implement those ones. We need to refocus more in the community. Yes. Put more resources there in prevention and promotion. You know, and that spans all the way from nutrition, vaccination, family planning, maternal health, and again, it is not a health issue. It needs to be linked up closely with eradication of poverty. Okay. People should have more funds to access that care. So the three things that came up in that meeting was the focus on newborn health, yes. Involving the community more, and then reorganizing our resources to the key things that are killing our children.
All right, well said, and we hope something definitely will be done. It's disheartening to hear that a huge number of the deaths we are witnessing are at that early age, before even they start living, pretty much, and that they're unregistered, you know, to have never counted as having lived. That as well, quite unacceptable. We hope something will be done, and with devolution, that it will in fact kick in and bring the solutions required. Dr. John Washira, Executive Board Member, Kenya Pediatric Association, and Hassan Emoy, who's Public Health Executive, Mandera County Government.